Hello, friends. Welcome to Million Innovators Network. I am your host, Jason Leopold. I'm a registered professional engineer in the province of Ontario, and I can be reached at jason.leopold@millioninnovators.com. Something about my background. I'm an engineer and economist. Most of my career has been focused on improving a process, either through implementation of new information technology capabilities or engineering technologies or any other technologies to improve the current process. For the last 25 years, I had hands-on experience doing all kind of business transformation programs, ranging from $50,000 to $50 million. During these years, I learned two things. Technology is important, but people matter more. For the last 5 years, my focus has become how do we actually execute innovation in a more systematic way? As a result of all the work, we developed this program for you. In this program, we wanted to explore how do we learn, how do we practice, and we share what we just learned. And the goal of this network when we created was a twofold. One, to help take the idea of innovation and make it more practical. Innovation is not an idea. Innovation is when that idea solves a specific problem. And the solution is the hands of the consumers who have a problem. So taking that whole idea of innovation one step further, we decided that we will share what we have learned so far, and we will continuously learn from each other. And we practice what we learned. An innovation that we create, an experience that we generate as a creation of the innovations, and we share with the network. And that was the whole goal behind the Million Innovators Network program. So this specific course is focused on doing innovation in regulated industries. Let me take a minute and define or establish a vocabulary. What do we mean by regulated industries? An regulated industry to us is something like a healthcare, a utilities, education, public transit, environment. An industry where the revenue and cost have two different currencies. Because of these two different currencies, the notion of a profit is often non-existent. So we wanted to explore possibilities. How do we do innovation in industries where this profit is not a primary motive? Here's a couple of things what happens in these industries often. The revenue and the cost is often fixed. And in that environment, appetite for risk for senior management to explore new ways of doing things significantly diminishes. If the risk is increased and reward is a minimum, the behavior of senior management doesn't work the same way that it works in industries where the innovation leads to higher profits. Higher profits lead to higher market share and higher price over earnings, and hence bigger bonuses. Here's an example: a publicly funded healthcare delivery system. The revenue is fixed. The cost is in currency, cost is in dollars. In these industries, the impetus to improve through innovation is often diminished. So we wanted to explore possibilities. How do we actually do innovation in regulated industries? So what happens is that all the known models that we have for innovation, this was a document created by Boston Consulting Group. They have these models, but each one of these models apply to different industries. This is a perception view that they had. There's an Apple model, where we know best. We're Nike model. We're listening. We will build what you want us to build. Toyota is a model we're not going to invent anything brand new, but we're just going to share other people's market share, steal other people's market share. Amazon, we just do best. Pfizer will protect their turf, and likes of JP Morgan, we're going to copy somebody else. We're just going to copy it very fast. So what happens in each one of these industry models? The primary driver is a profit. But we need to come up with a different model with the industries where the primary driver is not profit. So we wanted to explore something and say, how about if we create an innovation model for industries where the profit isn't the motivation, but being able to exploit their own competencies and capabilities and resources, come up with the new innovative capabilities that could be used internally, and at the same time help the entire industry do better. And therefore, the measurement of innovation isn't profit, but how we have leveraged these innovative capabilities to do better as holistically as a society, as an industry. And these examples could be used many times over. Here's what you do. Our reach is not limited to our value chain. We have to think beyond it, but extends to wherever our key stakeholders, or customers and care providers are. And we exploit our competencies to build the capabilities for our own use and give these capabilities away to the industry as a whole. Primary example of that is a healthcare. Healthcare delivery is a global industry for public good. So if one hospital can create capabilities, it could be used by everybody in the world, entire humanity is better off. So that's what we wanted to think about, is how do we create a concept of innovation in regulated industries where profit is not the primary motive. So what we did is, in our experience, we said, well, imagine this, if you're a hospital, you can take all your expertise and create a system or a capability that could be easily deployed across, and where we can use our competencies and experiences and learnings and reduce the probability of an error. What in healthcare delivery, they call the never events, things that happen that shouldn't happen. What if we do this? We know from experience, but the vital signs, what is this a particular patient is susceptible to. And we also know the skills of care provider. We also know the good practices, how do you manage that susceptibility. If we deliver that information at the point of care to most engaged provider, we could do two things. We could actually reduce the probability of error and then make this capability globally available, is reachable to people wherever there's a smartphone, and do it all under $1. That means it becomes affordable. There's no point of having innovation that nobody can afford. Healthcare is a prime example. As Dr. Atul Gawande said once, we can cure or manage almost any disease known to mankind. But unfortunate thing, 99% of the world's population can't afford them. So what's the point of that innovation? So here's what we're doing in this course. We wanted to explore these 4 methods, what we call them data points. They don't work isolation, they don't work sequentially, they work together. First, we look at the value chain, we look at the value, look at the stakeholders, identify opportunities. Then we take that opportunity and say, well, what an innovative nugget that we can create that will help us capitalize on this and protect our innovation. Then validate our hypothesis in real time by creating minimum viable products. And then at the same time, figure out how do we integrate that minimum viable product into value chain so we can scale up. Idea is not innovation. Idea is an idea. It is only innovation when it can get in the hands of the end users who can benefit from it. So this is our course. We want to explore these methods. We'd like you to join us. Register today. Let's explore this further. And welcome to millioninnovators.net. Thank you.